Hey there, Dr. Christianson here with you. Let's talk magnesium. A friend of mine, Dr. Kathy Head, wrote a good paper I stumbled across. 75% of adults are now known to be low in magnesium. And guess what? The tests are not very good, so the real number is probably higher than that, probably a greater quantity. And it's a big deal. So being low in it can totally make you tired, give you muscle cramps, palpitations, chronic pain, mood changes, but it can also be a factor causing sudden coronary artery spasm, which is behind a large number of heart attacks. So it's a big thing and totally critical to reverse. Good thing to make sense out of. So what does magnesium do in the body? Well, it's probably a better question to ask, what does it not do in the body? Almost all cell reactions and cell regulation takes place by membrane polarization. Your cells control what comes in and what goes out. And it's the polarization, it's the charge along the membrane that governs that. Well, magnesium is a critical part of that charge, of that gradient. It's stored inside the cells, about 99% of it is inside the cells, not much of it is in the bloodstream. But it's that gradient of all the magnesium in here and so little out there that lets your cells carry out their various duties. So to date, more than 600 known chemical reactions in the body are dependent upon magnesium. One more insight about that, because it's inside the cells, it's not as easy to test for. Blood tests show the extracellular fluid, the fluid outside your cells. Magnesium is an intracellular cation, so it's almost only inside the cells. So when you do see it low in a blood level, that's the 1%. So when you're so low that the 1% is also low, you're really in the tanks. And that's why the tests are not great, but also why it's even worse than those numbers might make it out to be. So why is everyone so low in this? Well, there's a couple parts of that equation. There's how much you get, how much you lose. And if you're losing it too fast, if you're getting it too little, either one or both, you can fall behind in that. So first off, how do you get it? Most plant foods would contain some magnesium. A reason they have less is that we use a fertilizer called NPK, nitrogen, phosphorus, potassium. And that fertilizer actually depletes soil magnesium. The other thought along those lines is that soils take some time to regain their magnesium after they make a lot of crops. And we do less crop rotation, not much if any. The crops that we grow will grow one season on this land and grow some same crop the very next season and not give that soil time to properly rest and recuperate. In many cases, organic foods are higher in magnesium, so that's one valuable distinction. Another difference is that we're eating less vegetables and more processed foods than would be ideal for us, and that makes us just consume less of that. So green vegetables, intact whole grains, legumes, nuts and seeds, they are the big categories of foods that contain magnesium. We'll talk about specific foods. Those are the main categories. So the more of those foods we consume, the better we do. Now the other part of the equation is why would we lose it? Why would we have less of it than we would need? Well, like other electrolytes, various factors affect what our rate of loss is. Sodium, potassium, we can pee out more or pee out less, but some things make us lose magnesium more quickly. One of which is mental, emotional, psychological stress. So the more we have various stress, various trauma, the more we lose magnesium more quickly. And that's why it's often talked about as being an important thing for helping the body buffer against stress and also to help to heal and recuperate the adrenals. So essential in those regards. Caffeine acts as a diuretic. In doing so, it causes us to lose magnesium faster. So greater amounts of caffeine also make us fall behind in magnesium. And that's one of the ways in which they make us more anxious, panicky, stressed, racing heart. Even apart from what caffeine does directly, many of those symptoms are from the magnesium loss as well. Another thing is higher sodium diets. So when we're consuming a lot of salt, our body has to pee out the salt faster or else we overload with it. And in that same process of dumping salt faster, we dump more magnesium. Then we've got vitamin D status. If we're not dialed in on vitamin D, we're not going to hold on to magnesium as well. We'll lose it more quickly. Well, digestive function. If your intestinal tract is inflamed in some capacity, That'll also make magnesium harder to absorb, and you'll fall behind in it easier. Then also we think about blood sugar. So this works both ways. When your blood sugar is erratic, your body loses magnesium, but then also when your magnesium's low, your blood sugar gets erratic. So it's one of those vicious self-perpetuating cycles. And also why magnesium is critical towards preventing the progression to diabetes, complications, early metabolic syndrome. It's needed for that. So I alluded to the pitfalls of testing, how this is inside the cells, you can't test it as easily. Well, there are serum blood tests that are very readily available and really cost effective. Anytime blood is drawn, they can check a box and check your serum magnesium level. Now, a pitfall is that that's not the first thing to show up when you're low in magnesium, because remember, that's the 1% pool we're measuring. That's not where it's stored. That's a little bit on the outside. And even if you're low in the stores, you can still squirt some on the outside and look okay on paper. So that's a pitfall about it. But worth to screen, and if it is abnormal, that's significant. That clearly is a problem. If it is normal, you could say, I still should work on this. I should still keep an eye on this. But if it's abnormal, you can really feel motivated to build up magnesium status. There are other tests. There's one called RBC magnesium. That one's nice because it's looking at how much magnesium is within your red blood cells. And that's one of the areas that it is stored. So that's a simple test that today many referencing labs can do, but specialty labs can do. So referencing labs, whenever blood is done, there's commonly, in America at least, Quest Diagnostics or LabCorp make up 95% or so of all labs processed. They're almost always getting your blood. And they can do RBC magnesium. Specialty labs are ones that are not in those circuits, places like Genova Diagnostics, Doctors Data, Metamatrix. These are ones used more so by naturopathic, functional, holistic type physicians. And they can run that as well, out of pocket, takes more time to process, but it's available. There are other tests. There was one called an EXA test, which would take a little cheek swab. That was really nice because it was looking at what was inside the cells of your cheek. And that was a great gauge of many key electrolytes, including magnesium. Not as commonly available, less cost effective. I would encourage definitely screen a serum level with your routine blood tests. Spring for an RBC if your doctor will go along with that. And regardless of that, be sure you are getting it in your diet and in some supplementation as well. So I talked about food categories, greens, beans, nuts and seeds, and whole grains. Those are all the big categories. Specific foods, Adzuki beans are one of the highest typical sources, very, very rich source of magnesium. I've seen some assays say 150 milligrams per serving, and that's a lot. We do well with a few hundred milligrams per day. So the Adzuki beans can take you close to all the way there. All other legumes are close follow-ups. Pumpkin seeds are also quite high. Sunflower seeds, almonds are very good in that. Quinoa has some. Some types of fish contain good amounts of magnesium also. We see that halibut contains nice amounts of that. Greens are all great sources. So spinach is a really rich source of magnesium as well, 50 milligrams or so per serving. So magnesium, kind of a neat thing in greens. There's this molecule we make, hemoglobin, that carries blood throughout our bodies. So hemoglobin is these 4 porphyrin rings centered around an iron atom. Well, plants make chlorophyll. So hemoglobin is like the red part of our blood. Chlorophyll is like the green part of plant blood. And chlorophyll has those same porphyrin rings, but it has magnesium at the core instead of iron at the core, and it's green. So kind of like plant blood. And way to think about greens being a real rich source of that. Supplementation is probably worth considering. This is one of the things to where many make this false dichotomy of, oh, don't take supplements because you should eat a healthy diet. Like, well, who said you can't do both? And this is a case to where eat a healthy diet, but know that it's possible to still fall short, so close the gap anyway. There's different versions of magnesium, and some of them can be intestinal irritants, some are harder to absorb, and that's why you see a lot of forms of it on the market. My current personal favorite is dimagnesium malate, which is a version that is a plant-derived type of magnesium, so very well absorbed. The trade-off is that other types of magnesium work better as a laxative because they're not absorbed. But this one is less of an effective laxative, which is great, but it's well absorbed as magnesium. Speaking of laxative though, if someone does have hard to manage constipation, magnesium is one of the gentlest, safest laxatives that can be used for those purposes. And a difference is that it's not an irritant stimulant laxative, so it won't make your bowels weak or your bowels dependent on it, and it's safe to use as needed. Magnesium citrate is actually one of the better versions of magnesium when you're thinking about it more so for laxative purposes. General action steps, though, go way out of your way to do several of those sources of foods per day. Intact whole grains, quinoa, whole grain oats, wonderful foods, legumes, greens, nuts and seeds. Those are things you want to get anyway. And do some supplementation, do some screening. Make sure it's all going to be okay for you because it's super important. When magnesium's topped off, you have better, steadier energy. Your muscles enjoy movement. You don't feel sore and stiff as easily. You can stretch out and become more limber and have less tension. And it's funny because like tension, we think about that physically, like tight muscles, but also psychologically. And we see that with magnesium as well. When we're lower in that, we're more stressed and more tensed, and things affect us just stronger than they should. So take great care. We'll talk again really soon. Bye-bye.